Hi, I'm just going to spend a little bit of time talking about gum health. A lot of people are asking, what is it that causes your gums to be red and to bleed? Well, let's say during lockdown, we're not in our usual routines, and maybe we're missing brushing our teeth or cleaning in between them as we may have done. In your mouth, there are millions of different kinds of bacteria, and they appear straight after you've brushed your teeth, really. You can't see them even with binoculars, and you can't see them with your bifocals. And over time, the bacteria just build up on your tooth surface until they start to have the appearance of what we know as plaque, which is the substance which is a bit like cream cheese, really, building up on your tooth surface. Your body will then send more blood cells into your gum area to try and get antibodies and blood cells to fight the bacteria that are here. So because there's then more blood in the area, that's why when you clean them, they can bleed a little bit. The worst thing you can do is to stay away from the area, because if you do, it'll just going to get worse, and eventually that is what's going to make your teeth loose. And gum disease is now not only linked to your gums, but it can cause chronic systemic diseases or contribute to them, like heart disease and diabetes as well. So if you're scrubbing your teeth hard, so if you're really giving it a good clean and scrubbing hard with a hard toothbrush and they're sore, that's what's causing them to bleed. So cleaning them really carefully, but not aggressively, really. So if you can, an electric toothbrush, not for 20 seconds, but for a couple of minutes, not once a day, but twice a day. You can use floss, or you can use little brushes to clean in between your teeth daily. And try and clean all 5 surfaces of your tooth. So not just the outside, the inside, and the biting surfaces, but the 2 surfaces that are in between your teeth as well. So using your floss and using your little toothbrushes every day. If the bleeding is all over your mouth, then you can use something like a chlorhexidine based mouthwash like Corsadil. But just make sure that you don't have any allergies to it, and make sure that you read the instructions underneath, which are often underneath the peel off label there. So if it's the full strength one like this one is, read the label, as I've said. Don't use it for any longer than a month without having a break from using it. Don't use it straight after brushing, because the toothpaste can stop it working quite as well. And also try not to start drinking tea and coffee, red wine, for about an hour after you've used it. Otherwise it will increase the amount of brown staining that it can leave on your tooth surfaces. So the mouthwash isn't magically going to cure your gum disease. You need to be having good cleaning and having dental treatment as well. So look after them while you're at home, and hopefully it won't be too long before we'll be seeing you again at the dental suite.